We are back on Kababayan Today. We're celebrating our Filipino-American nurses, as we should, for all the work that they do for our community. So I want to welcome on the show the panel that is joining us. They were here last week, and we're also talking about all these issues that pertain to being a nurse, and I didn't realize maraming issues just because of the work that you do, the long hours that you work. I was under the impression, because what do I know, but you work 3 days a week, you get paid a lot of money, and that's it.
No.
Marietta, that's not the issue?
No.
No?
No. I think in the past, the poor working conditions, the low wages, the lack of respect from our employers, among many other things, were what drove us into organized labor. And not only UNAC, but CNA, SEIU.
So these are other organizations?
Other unions. And for me personally, in my hospital, and I've been there more than 30 years, we knew we had no other way but to raise a collective voice. And how to do that? It was through organized labor, through the union.
Okay.
And our first attempt was a complete, I mean, it didn't go through. And that was with another union. And in the second time around, a couple of years later, we didn't give up. We knew it was the only way to go. And a couple of years later, we did it with CNA.
Okay, so the question is, were the things that you were asking for, were they given to you when you became
unionized?
Unionized.
No, not on a silver platter. We fought long and hard. We got decertified the first time around once we voted in CNA. And then when we couldn't get a contract through, it took us 18 months to get our first contract through. It was a very long struggle. And in that process, they fired 200 nurses, closed 2 units, which they later had to open up because the California Department of Health said it's illegal. And so it was a very long struggle, but we persevered. And to this day, it's still a struggle. It's the same issues, no breaks.
Because, I mean, under the law, you are required to take a meal break or a 10-minute break, especially if you've been...
Oh, but believe me, a lot of hospitals will try to get away with you not taking a break, even if there's... Charmaine had mentioned the racial law, okay? And
what is the racial law?
The racial law is the only one of its kind in this country. It's only in California. And we're hoping that through Barbara Boxer's bill in Congress that it would become nationwide. What it is that it limits the amount of patients a nurse can take care of in different units. Like in critical care, we can only have 1 to 2 patients each. That's the law. And then in med-surg, 5, in step-downs, 3 to 4, and so forth. And that was a long battle fought hard.
Right.
Yeah, by everyone.
Because, I mean, if you don't speak up, then how are you going to divide your time and your dedication? If you have 10 patients at iisa ka lang,
right?
Diba?
But that's the thing, you know. We thought we won that. Okay, it's the law, and incorporated in that law is the relief language, which means you have to relieve the nurses for their breaks.
Right.
Okay, lawfully it's like 10 minutes every 4 hours.
Right.
So for a 12-hour nurse, that should be a
30
30-minute
minutes,
total,
yeah.
right? And a 30-minute break.
Right.
Okay, but now we're seeing the faces of our employers changing rapidly. Now most of our employers are big corporations, okay? It's not the small independent hospitals in the past, the one that, you know, I was inundated. Yes. Now they're big corporations. You hardly ever see an independent hospital, one Good Samaritan being one of them. So now you have this employer that's not necessarily present in the building.
Yeah, there is no face to the employer.
Right. They're maybe headquartered in Texas or in Tennessee or Kansas. They're looking at you only as numbers And now it's healthcare in America, and I'm finding that also in the Philippines and my many travels there, it's profit driven. It's not patient care issues anymore. It's not taking care of the patient, but to show profit. You know? You're beholden to your shareholders, okay? So you're not necessarily providing a good quality patient care because you have to cut costs, for instance. Where do you cut costs? You try to roll back the racial law, okay? So, I mean, instead of, you know, giving the med-surg nurse just 5 patients, wouldn't it be more profitable if you gave her 10?
Right, but then you suffer because of the kind of care that you're giving the patient.
For most of us, the patient suffers.
Right, okay. We are talking about these topics that I had no idea. No idea, and I'm glad we're bringing them to light here on Kababayan Today. When we return, we'll talk about more of these issues. Very important in our community. We'll be right back.